Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is very interesting, and the topic today is the criminal law attorneys and what they do when they come into the picture of the law field. Joining us today, my guest speaker is Anjali Prasad, and she is a criminal defense attorney. She also is the owner of Prasad Legal and former federal prosecutor. And we are very privileged to have her, since she will give us some background about what is law, what is the practice of law, and when they enter into the picture. Good morning, Anjali, and welcome to my show.
Dr. Prasad, good morning to you.
And I'm very privileged to have you because you are here today to discuss some of your practice in healthcare fraud.
Yes.
So before we get started, please get me oriented and our viewers. What is healthcare fraud?
Okay, sure. Well, I'm a federal criminal defense attorney, and the bulk of my practice involves healthcare fraud. And healthcare fraud is basically an allegation that the government brings, the federal government or the state government, against healthcare providers. It generally involves how the healthcare providers are billing the insurance company. So, for example, the government might think that the healthcare provider is overbilling. The patient might come in for one procedure, and the healthcare provider is being accused or charged with overbilling, billing it for a different procedure. Or frequently, the government charges healthcare providers with billing what we call fake patients that don't even exist. Okay. So this gives rise to healthcare fraud charges.
So that's good, Anjali. Before we go further, can you please give your introduction to our viewers? You have such an extensive CV that I just want you to make it briefly. Let our community know about your background.
Okay, sure. I grew up here in Michigan. I went to Emory Law School, University of Michigan and Emory Law School in Atlanta, and I took a job as a criminal prosecutor, actually, with the Philadelphia District Attorney's Office. And then I came back home to take a job with the United States Attorney's Office, the Federal Prosecutor's Office. So in total, I have about 15 years of prosecutorial experience as a prosecutor.
Yeah.
And then I left. I started my own firm. It's called Prasad Legal. It's here in Bloomfield Hills, and I'm mostly focused on federal criminal defense.
That is very good. This is excellent. So now, question number 2. If the healthcare provider is not billing correctly, how does the government get involved?
Okay. So what happens is the insurance company basically has a standard where the healthcare provider should be. What codes are being used, how many times they are being billed, etc. So if the healthcare provider is kind of outside of the standard, boom, the government gets involved and starts investigating. And sometimes if I'm hired kind of in the beginning of the investigation, we can ward off criminal charges. Sometimes the criminal charges get levied and I come in after they're levied, and we end up negotiating a resolution with the federal government. Either we go to trial if we are wrongly accused of the allegations, or sometimes the healthcare provider does admit that there was some discrepancies in the billing, so we negotiate a deal that fits the conduct.
So tell me one thing, because I'm not used to this law field. When the client comes to your office, how do you handle them? What do you do initially? What do they expect from you first visit?
Well, that's a good question. The client client is always angry because 9 times out of 10, the federal government has got it wrong. For whatever reason, they think the client has done wrong, but in fact, the client has not done wrong. It's just administrative problems, or maybe somebody somewhere wasn't dotting their I's and crossing their T's. But most of the time, the allegations don't fit what happened. So the client's angry, and they basically need somebody like me to go to court and take on the federal government and say, hey, you got this wrong. This is what actually happened.
Okay. So that is right. So you pacify them. You get all the informations you can from them, right?
Yes.
And then you get involved with the further legal procedures, right?
Yes, and by information, it's not just the healthcare provider, but usually the healthcare provider works for an organization that has a staff. There's always a billing component to that staff, whether they have an in-house biller or an independent biller. So it takes a lot of prep work to get into the organization and kind of figure out what the problems are and where the discrepancies are.
Okay. So basically, you must be doing a very thorough study of the whole situation, right?
Yes, and I was a former federal prosecutor, so
you know,
I kind of know the
you
inside.
have a double advantage, federal court prosecutor and now this end.
I do.
So you know a little bit of both there and this end, and
Yes.
that's okay. So now the other question is when you enter the picture as attorney.
Okay. The best time for me to enter the picture as an attorney is before any trouble has even happened. For example, if the healthcare provider has an operation that involves a staff and billing, etc., if that person's in charge, the best time for me to get involved is they would hire me to get into the organization and make sure the billing codes are properly being administered. The staff is well aware of the policy. There's policy manuals in place that people follow. So basically, I get hired to kind of I'm preemptive against any problems.
Okay.
Now, that doesn't always happen.
Right.
Sometimes.
Yes or no, right?
Right.
Yeah, there is always yes or no.
Yes,
Okay.
yes. So sometimes, for whatever reason, the healthcare provider didn't have anybody conduct an internal audit or analysis of their facility and their practice, and now they're on the radar for potentially fraud. So then that's the next time I will get hired, is kind of when they're already in the fire and the government's saying, hey, you did something wrong.
Okay.
So then you come to me and I unpack the problem and I get it resolved.
When they come to you, you expect that they are telling you the truth, right?
I do expect that they're telling me the truth, and there's no reason not to tell me the truth because you might not know this because it's not your field, but anything a client tells me is protected by attorney-client privilege. So they can say, I did it, or I didn't do it, or the truth is halfway in the middle. Whatever they tell me is 100% protected. So it's not a matter of trying to convince me to be the best lawyer for them. I'm already on their side, and I can best represent them if they are truthful. And there's no downside to being truthful with your attorney.
Right, and not only that, then the federal prosecutor, they have all the information anyway because they are the government people, right?
This is
so you
very
just have,
true.
You are meeting a big challenge.
It's
How do you face those challenges?
It's very difficult to take on the federal government.
Exactly.
Now, I represented the federal government for a very long time.
Right.
So that gives me a kind of an advantage when I'm walking into court because I was inside the federal government, so I know the strategies and how they think and how they put together a case. So I think that's why a lot of people end up hiring me.
Yeah, the strategies you know already.
Yes.
And you know exactly who stands where.
Right.
Where is federal government, and there you are fighting against them. So it has to be a good cooperation, right?
Yes, the relationship between the client and the attorney has to be very, very tight.
Right.
And there should be no. I tell people all the time to hire who their gut tells them to hire, because at the end of the day, you put your life in my hands.
Exactly.
So you
exactly.
have to feel.
Yeah.
You have to feel the connection with your attorney.
That is very true. But suppose I am the doctor and I'm being convicted, I did this wrong. Not that I have done any. So far with my clinical practice of medicine, I can say safely, no complaints against me, no charges. But suppose if I get involved, then how do I reach you? Do I reach the federal people first before I reach you, or do I hire you as a
Okay,
Which one
actually,
comes
yes.
first?
No, that's
Yeah.
a great question. Please
Yeah.
do not contact the federal government if you think you
Okay.
are
If I'm-
under investigation.
Okay.
If you think you've done something wrong, if you've gotten a letter that says you've done something wrong, if investigators come knocking on your door
Okay.
and say, "Hey, we want to talk to you," no, you do not hire
Do
the federal
not.
government.
Okay.
Come to me, and I will give you a courtesy consultation, and I will tell you exactly what your options are,
Sure. Yeah.
and then we'll go from there.
Good, because I will still keep seeing the patient. I will be very careful that I don't make any mistake with anybody. But then I know that for moral support, I have a lawyer.
Yes, and
That you will be.
Yes, and it's
Right.
not a bad idea to have a lawyer while you're practicing. Just
Right.
a go-to person who you can run your issues by, and just have kind of an independent person say, this is good, this is bad, this is in the middle.
Right, yeah. So, during my all this year of clinical practice, I always did it. I always work in the major hospitals.
Yes.
Henry Ford, St. Joe, Bowman, practice emergency medicine, my own thing. And so far as I remember, I never did get involved with anybody, any particular patient, except for one in the emergency room. I saw him, just for a regular checkup and pain medication because of pain all over. And then he kept on coming back to me 2-3 times, wanted more prescription, opioid and this and that. So that was a very dilemma for him. I stopped getting anything to him and I said, you just go and see your own doctor. I don't want to give you, I cannot give you anymore because my license, even though
Yes.
I have a DEA, I just don't want to use my license for those. So finally, he disappeared, never came back to me.
Well, that might have been the best professional decision you've ever made.
Right.
And I'm glad you mentioned prescription opioids because that's
because
another.
I'm coming to it,
Yeah, that's another large part of my
Yeah.
practice.
Opioids. I have
Where-
a list of all the medication for you.
Yes, and healthcare providers are often charged with overprescribing or prescribing opioids that are not
Right.
essential. So that's another 50% of healthcare fraud is billing.
Billing.
And 50% is opioid prescriptions.
Okay, billing and the opioid.
Yes.
Right, yeah. And this is all, then everybody, these days, everybody is getting so strict. Even as a physicians, getting our license renewed is not an easy job for me.
No, it's not.
Before it used to be so easy. Not anymore, class 1 drug, class 2,
Yes.
class 3. So
Yes.
it's a big hazard. So, Anjali, I have a list of certain prescription pills that has been used when I worked at the emergency room at a major hospital or even the urgent care setup because, I worked both urgent care, emergency room, plus my own practice.
Yes.
So opioid is one of them, and then Michigan automated prescription system, opioid becomes number one in all this, and now fentanyl. Fentanyl-laced drug, and so tell me about this. Can you explain about the use of opioid and how regulated it is?
Well, you mentioned the Michigan Automated Prescription System.
Right.
That's MAPS. And probably in the beginning of your career, MAPS was not an available tool
No, it
for
wasn't.
healthcare providers.
No,
but the
no.
good news is it's a great tool for healthcare providers.
Okay.
And what MAPS is the state of Michigan keeps a record of what prescriptions are being prescribed to the patient. So
From different clinician, right? Not just one.
yeah, so for example, let's assume I'm the patient, and let's assume I go to 10 different healthcare providers.
Right.
My back hurts, my foot hurts, I don't know, my head hurts. I have a bunch of issues, and I go to a bunch of different healthcare providers, and every healthcare provider prescribes a narcotic for me, an opioid.
Right,
Well, the
yeah.
state of Michigan, thankfully, keeps track of who is prescribing me what.
From where?
Yes.
Okay.
So from a healthcare provider's perspective, it's very important that before they prescribe me the narcotic, they pull my maps and they see who else is prescribing me what.
Okay.
And that's kind of an easy safeguard for healthcare providers that they don't usually, or they don't often take advantage of.
Okay, so in that case, I ran into an emergency situation. He comes with a severe back pain. Basically, it was a toothache. You know how bad that could be.
Yes.
So I prescribed him some codeine and all those. He went to pharmacy downstairs, and the pharmacist said, Dr. Prasad, no more prescription for him. So that was a very difficult situation for me. So what I did, in that situation, correct me if I'm wrong, I just prescribed him like four pills, and I told the pharmacy, please just keep him, pain-free during the night, and
Yes.
the next day he will meet his regular physician. Did I do it right, or did I not do it right?
I'm sure you've done everything right. Let me just say that.
No, you criticize and you correct me, so in future I won't be making any mistake like
Well,
that.
in general, the fewer amount of pills you can issue to the patient, the better.
Right.
And the less in strength, the better, in general. Now, I represent a lot of individuals, healthcare providers, who work in pain care centers, pain care
Right,
clinics,
yeah.
where
That is another
patients come in and the pain is overwhelming. So they are eligible candidates for
Yeah.
very, very strong narcotics.
Yeah.
The best safeguard against those kind of practices
Yeah.
is to check what has been prescribed recently, check the MAP system,
Okay.
and kind of make sure, do an internal check and make sure you're not making any mistakes with the overprescribing.
Right, yeah.
And that's another thing that I might do if you hire me to kind of evaluate your practice.
Right,
I would pull the maps and I would talk to the healthcare providers. Often it's multiple healthcare providers, and we'd get a target of what is acceptable in terms of prescriptions and what is an outlier.
Right, yeah, because things have changed now. It's not just opioid, it is fentanyl, it is so many things.
Yes.
And even though I have, I can prescribe anything, still I'm very, very careful.
As I think
Yeah.
everybody should be.
Right, yeah.
It's-
But see,
yeah.
during the night time when they are at emergency room, there's not too much you can do. You cannot call their private physicians.
Yeah.
You cannot call. The only thing that I have is what will I do at the emergency room for them? Like, give them an injection of Toradol or something, relieve them. But
Right.
the only good thing that we have is this pharmacy.
Yes.
Yeah.
Yes,
so-
which is the pharmacy acts as another internal check on the
Right.
prescriptions. But I must tell you that pharmacists also are very much targeted by the federal government. And a lot of my clients
Exactly.
are pharmacists who are being charged with dispensing the prescriptions improperly.
Yeah. So even the pharmacists
Yes.
are under you.
Yes.
So you have a lot of targets to work with. You have a very difficult job.
Well, it's not. When you think of healthcare fraud, you assume that it's just doctors. But my clients include, like I said, pharmacists,
Physical therapist.
heavy practice for physical therapists,
Right,
nurses, nurse practitioners. I mean,
I forgot about the nurse practitioner. They are
Yeah.
another big target, right?
They are, because
Target.
they have prescription privileges. So a lot of, I'll say this, the federal government doesn't discriminate against you for your profession. They're going to look at your prescription practices,
Okay.
and whether you're a doctor, nurse practitioner, physical therapist, what have you, they're going to investigate you, and if they think you're an outlier, they will come knocking on
They
your door.
will come back. But during my practice, the clinical nurse practitioners, they didn't have any right to prescribe this medication. Slowly and
yes.
gradually, the government became more
Right.
lenient to them. Yeah.
Yes, over time, the ability to prescribe has been broadened.
Has
Yes,
been
yes,
broadened. That's
yes,
what I mean to
yeah.
say. Because now they can do everything. And I remember even working at the emergency room, I'm the senior staff, there are a lot of PAs working with me. At the end of the shift, I have to go through their chart and sign.
Yes, and I'm actually glad you mentioned that,
Yeah,
because
so
I
tell me
have
about this, yeah.
I represent a lot of healthcare providers, physicians
Right.
who oversee PAs and NPs.
Exactly,
And
yeah.
so the PA or the NP might make the recommendation for the prescription, and the physician comes in and signs
It
off
just
on
signs,
it. But
yeah.
that physician is 100% accountable for the decisions of the PAs and the NPs.
Okay.
So you
yeah.
can see how there's a lot of room for things to slip through the cracks, because
Right.
the physician might not be the person evaluating the patient. It might be the NP who recommends that something gets prescribed, and then the
Right.
physician signs off on the
And then
prescription.
the clinical nurse practitioner, she will bring that, she will put the prescription in. And
Yes.
since you
yes.
said now they have become more liberal about them using those medications.
Yes.
So that's very good. Yeah, they check them before issuing. So as a lawyer, you have to be very, very careful, right?
Yes, you have to be, you want to hire somebody who's extremely meticulous and
Right,
who knows the laws very, very
Yeah.
well.
Would you like to share any of your experience? Interesting one, so we can,
Let me think. I've had too many healthcare fraud cases to even quantify, but I can
Exactly.
tell you that the trials are very difficult.
Yes.
They are winnable 9 times out of 10,
Yeah.
but they are very, very hard on the client and the client's family. So if you decide to go to trial, you better know in your heart of hearts that you're completely innocent, because the government has a magnificent way of taking very, very small discrepancies in your practice and blowing them up to make it seem like you're the criminal of the century.
Right. So as a criminal defense lawyer, when you are in the court, you had to be very, very careful, right?
Yes.
Yeah.
Yes.
So what is the most pathetic situation that you had, in your life, like you were defending somebody and they were found guilty, and then
Well,
must be emotional torture for you also, right?
yeah, the guilty
Yeah,
verdicts
the
are
guilty
very,
verdicts,
very
yeah.
difficult because they're never expected.
Right.
There's 2 ways to resolve a criminal case.
Right.
The person can plead guilty,
Okay.
assuming they are guilty or have some guilt,
Right.
and you can negotiate the sentence. Sometimes you plead guilty and the government agrees to put you on probation. Sometimes they might agree to a fine. Sometimes you might have to agree to go to prison for a very short amount of
Spend
time.
some time in the prison,
Yeah.
and then you
Right.
you try. You have more time that way, right?
Right. But if you don't want to plead guilty and you believe the facts are on your side, you have to go to trial.
Right.
And the saddest cases are, the individuals who go to trial and they get that guilty verdict at the end.
Yeah,
and
that is
I
must
can't
be-
tell you how many times people have said, "Oh, I should have pled guilty." But the decision
Right,
is
yeah,
personal.
no.
It should be based on discussions with you and your family and your attorney. And
Must be a real emotional situation for you, being the criminal lawyer and defending, and then see them going.
well, it is very hard on me, which is why I
know.
keep my volume low. A lot of
Right.
criminal defense attorneys, you'll call them and they'll hire you, and boom, you're one of hundreds of clients. But I keep my volume very low for a reason, and that's so I can be accessible to the client and give the client the best representation that they deserve.
So, Anjali, last question, last 1 minute wrap up of your talk. What would you advise? What is your final advice to our listeners?
Okay, 1 minute wrap up. Well, first I would say don't wait until you're the target of a federal indictment. If you are a practicing physician or healthcare provider
Right.
and you don't have anybody who's kind of doing an independent audit of your practice, please call me and we'll put together a plan.
Okay.
Now, if you are indicted and you need representation, please call me and we'll put together a strategy.
Either way, call Anjali.
Yeah,
The Prasad Legal,
you can
right.
reach me on my website.
Right.
It's
So how can my audience, whoever is listener today and more, contact you if they have more questions?
Yes, I'm very easy to find. Google Anjali Prasad or check out my website, which is prasadlegal.com.
Got you. Hopefully, I won't need you. Hopefully, because, I'm a sincere practicing medicine for all these years in my life, but I can always refer you to my other colleagues who are in trouble,
Well,
right?
Dr. Prasad, I know you
Yeah,
won't need
yeah.
me, but you can call me for a cup of coffee.
Or a cup of coffee. So I'd like to thank you as my guest speaker, Anjali, criminal law attorney. I'd like to thank our viewers for watching me today on this interesting health talk.
Thank you, Dr. Prasad.
And I'd like to thank our producer and camera people. And until I see you again, I expect everybody to have a wonderful holiday season. Thank you again.
Thank you so much.
Thank you.